For families who decide that their intention is to continue with the pregnancy, then we'll plan what will happen for them and for their baby after the baby's born. And that may involve lots of different aspects of care, and we will try and tailor it as best we can to what that particular family needs. We find that the most important factor is good communication and sharing of information, so families are empowered to be able to make the decisions for themselves. Part of the things that we try and work on together with our obstetric colleagues, with the family and with our neonatal team are options for delivery. What will happen to the baby after the baby's delivered, whether the plan will be for the baby to spend the majority of the time with the family, whether for that family it's more important for the baby to come to the special care nursery and receive some investigations in the nursery, potentially to confirm diagnosis or to assess severity of a diagnosis which may have not been certain antenatally. If parents have elected to continue on a pregnancy with the knowledge that the baby is not expected to survive for very long, then we can also support them in other ways, and in particular involve our palliative care team that we work very closely with here at the Mater, who can provide support not only in the antenatal period to get families ready for what may lie ahead, but also in the postnatal period and even after discharge home, if it's important for that family to get home with their baby and be in an environment which is supportive to them, or in a baby who may not be expected to survive but may be expected to live for some days or weeks, then it's important to make sure that we have a plan in place so that that family can take their baby home and spend as much time as possible together being a family. Some families will have very strong beliefs and know exactly what they need, which means that we are not particularly involved at the time of birth. Other families find it very reassuring to have the neonatal team there to be able to confirm that what was expected is in fact the case and that they can go forward with their planning from there. What we find is that our postnatal management will be very much guided by the opportunities that we've had to communicate and develop plans antenatally, and to have that time to be able to make those plans is actually the most important thing, both for the medical teams and for the families. And if we can all be on the same page, it usually means that things go much better for the family concerned. Sometimes at that initial meeting, parents are very much in denial, and they may often be looking to us to change the diagnosis or to be able to provide miraculous treatment. And sometimes that can be very hard in situations where we're clearly unable to do that. But as the relationship develops, I think what parents most want from us is the ability to help them through the journey, to find the choices that are right for them as they embark on this very difficult journey, to be consistent in the message that we give them, and in particular for those parents, sometimes offering false hope can be a very damaging situation to put the parents in. And to be able to be consistent and support them on a journey which may not be the journey that they had envisaged when they first got pregnant and planned to have a baby, but one that can still be fulfilling. They can still take positive aspects from that journey, and the preparedness for that is a really important aspect. What we try to do is to provide a service which works for families. We try to help them make the decisions which are right for them. And it's very difficult to try and dictate how management will go and what particular services will be offered to particular families. And the only way that we can get it right is to be open and upfront, to discuss the plans for each individual condition and for each individual family, and two different families diagnosed with babies with the same thing may react in very different ways and actually end up travelling different paths and different journeys. And each one is right for that family, and our job is to support the families in the journeys that they choose to make.